My next guest is a world-renowned dentist who treats well-known celebrities and athletes. People actually fly from all over the world and even around the country to be treated in New York by Dr. Pankaj Singh. He even authored a best-selling book on implant dentistry with his distinguished background as an oral implantologist. He's also the director of Arch Dental Associates. Welcome to BNC, Dr. Singh.
Thank you so much, Lauren. Happy Earth Day.
Happy Earth Day to you also. Can you start by helping us understand why poor dental care can cause problems with sleep and other health issues?
Sure. So the oral health has been linked to overall systemic health, and that's been known for hundreds of years. In ancient Indian and Chinese cultures, the one way to look and evaluate one's overall health was to look at their mouths, look at their eyes, look at their fingers, the nail beds. So the mouth can tell a lot about the overall health of a person. And oral health directly is linked to a lot of medical conditions and worsening of medical conditions as a result of dental disease. Periodontal disease, which is gum disease, has been linked to heart disease, certain kinds of cancers, lowered immune response, higher incidence of diabetes worsening. So there's a lot of interrelationship between dental disease and overall health worsening.
And people are concerned, of course, because of COVID, they haven't been seeing their regular doctors, dentists, eye doctors, and so forth. But can you tell us about the safety of going and seeing your physician or your dentist with regard to these other issues in light of COVID concerns?
Absolutely. You know, healthcare professionals have taken this very seriously from the very beginning, and dentists and physicians have been truly champions of not just patient care, but also patient safety. Dentists in particular, for the most part, there hasn't been one, as far as I know, and I'm the editor of 2 academic journals. A lot of time is spent in the academic world. I'm a researcher and professor at major universities here in New York. So I can tell you that there hasn't been one reported incidence of a patient becoming ill from contracting COVID from a dental office. So that just goes to say how safe dental offices and visiting your dentist can be. Dentists have really gone above and beyond what would be considered safety protocols, from something very simple as really restricting the number of patients that they see, per hour, to literally 1 or 2, and restricting the amount of people that are visiting them or sitting in a waiting room, and social distancing, installing high-powered vacuums, not just in the operatory, but also in their offices. We're using UV lights to sanitize the rooms between patients, using fumigators to sanitize, the rooms between patient visits, staggering the patients between dental rooms, so not seeing enough, as many patients as we once used to. Of course, the normal, CDC protocols, mask, gowns, gloves, eye protection, that goes without saying, but also really taking it to a different level of, double masking. I can't speak enough of
That's
how
good to know.
how well the dental community has responded to the challenges that have been put onto them. And I'm so proud to be a member of the dental community, and truly couldn't speak more highly, and couldn't encourage patients more on really taking care of their oral health and following up with their dentist for their routine care, because not following up and not maintaining adequate and routine care can really cause a lot of harm. People with gum disease, people with active dental disease, toothaches could turn into root canals, could turn into infections, abscesses that could seep into the bloodstream and can cause other infections. Things like sleep apnea can get worse because of the sedentary lifestyle. We haven't been able to go to the gyms the way we used to, where we have we have sleep restriction, we have sleep deprivation, we have our system, our literally our schedule has been turned upside down, so we don't sleep well, and as a result, unfortunately, we've gained weight overall as a population. We have We have gained weight, and that all increases the incidence of sleep apnea. And 80% of the things that actually do
So
contribute to
much.
obstructive sleep apnea can be found in the mouth. So not visiting your dentist can really do one harm.
Well, we had no idea, Dr. Singh, but we appreciate you telling us about all that. Thank you so much. We're out of time, but thank you so much for joining us here on BNC Live.